Hello everyone, thanks for joining me today. My name is Sagar Ali Rebani and I'm excited to talk to you about something that's becoming more and more important. The topic that we're going to talk about is about best practices for implementing AI and lean methodologies in hospital supply chain management. We all know how crucial the supply chain is in healthcare, especially after the challenges we've faced in the past couple of years. Today, I'll walk you through how AI and lean practices can combine to improve the efficiency and how predictive analytics can make a big difference in keeping hospitals running smoothly. I'll also share some stats and examples to show how just impactful these methods can be in real world scenarios. Before jumping into the presentation, firstly, we'll see here's the list of co authors of this research, along with their institutes and departments. Now, let's jump to the actual agenda of the presentation. So, here's the plan for today's presentation. We'll start by looking at some of the common challenges hospitals face in their supply chain. Then, we'll dive into how AI and lean methodologies can address those challenges. After that, I'll show you how this plays an important role in hospital supply chain and will share some interesting insights. My goal is to give you a practical understanding that can help hospitals cut costs and improve patients' care. Alright, let's be honest for a moment. Hospital supply chains can be a bit of mess, like stockouts, expired supplies, insufficiencies, you name it. These problems don't just increase costs, they also risk the patient's care. I'm sure you remember during COVID 19 when hospitals struggled to keep PPE and ventilators in stock. That wasn't just a hiccup, it exposed a lot of underlying issues in how hospital supply chains are managed. That's why it is important to look at ways we can streamline these systems. By using AI and lean methodologies, hospitals can make sure that they're always stocked with the right supplies at the right time without unnecessary waste. Having said that, now let's talk about the lean. What is lean? It's all about reducing waste and making process more efficient in hospital setting. That could mean reducing overproduction, waiting time, or excessive inventory. For example, the concept that I like the most is just in time, what we simply call GIT, inventory management, which is a core concept of lean, has helped some hospitals reduce their inventory by 35% and supply chain costs by 20%. That's huge, right? Imagine this kind of savings that can lead, and also the perk is that you'll never face the problem of overstocking. Lean is really about creating a system that's agile and responsive, which is exactly what hospitals need, right? Okay, now let's shift gears and talk about AI, the game changer. AI can predict what supplies are going to be needed based on patients' data, historical trends, and even the things like seasonal demands. It can automate purchase orders, so you're not relying on someone manually keeping track of inventory levels, which, let's face it, is bounded to have some human errors. Hospitals that use AI for supply chain management have reported faster decision making and fewer stockouts. And that means better patient care because the supplies are there on time. AI is like having a super efficient assistant managing everything behind the scenes. Okay, so if you're wondering how hospitals can actually start implementing AI and lean, here's what's important. Firstly, you need to buy in from clinical staff because they are the ones who will be using those systems day in, day out. Secondly, regular audits, training are the key takeaways for making sure that things stay on track. And don't forget about your suppliers. Having a good relationship with them can actually help smooth things out, especially when it comes to timing and availability. Okay, so hospitals that have already done this are seeing major improvements in both cost and efficiency. Alright, so what kind of impact are we talking about here? Well, hospitals that have integrated lean and AI simultaneously have seen a 33% drop in inventory and a 67% reduction in stockouts. That's huge, obviously. And the kicker, supply chain costs have gone down by 20%. But it's not just about money. Patient satisfaction has also improved by 13% because they're getting what they need at the right time. This isn't just a theory, it's already happening in some hospitals, and the results speak for themselves. Alright, now let's talk about predictive analytics. This is where AI really shines. AI can look at all kinds of data, from patient records to seasonal trends, and predict what supplies you're going to need. Think about it. For example, if flu season is coming up, AI can tell you to start stocking up certain medicines ahead of time. It's like having a crystal ball for your supply chain, helping hospitals stay proactive instead of reactive. This predictive power that helps hospitals keep a smooth flow of inventory and avoid those frustrating shortages. Alright, let's take a quick look at the difference between lean supply chains and the traditional methodologies. Well, in a traditional supply chain, hospitals tended to keep order in bulk and keep a lot of stock on hand just in case, but that leads to overstocking, waste, and expired products. Lean supply chains, on the other hand, focus on getting what you need when you need it. Nothing more, nothing less. This approach reduces waste, lowers cost, and keep the process running more efficiently. Hospitals that have switched to lean are seeing major improvements in how they operate. To wrap up things, the combination of lean and AI is a powerful tool for hospital supply chain management. By cutting down on waste, reducing cost, and improving efficiency, hospitals can provide better care for their patients and avoid those critical stockouts. As healthcare continues to evolve, it's clear that hospitals need to adopt these innovative strategies if they want to stay competitive and meet the growing demands of patients. And the best part is, these changes are not just theory. Again, they're already making a difference in hospitals around the world. Alright, everyone, thank you so much for your attention today. I hope this gave you some useful insight in how lean and AI can transform hospital supply chain management. If you have any question, you may ask. Thank you once again.